Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shalender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Hello, this is Dr. Sodhi, and I'm going to start program. Hopefully, I think there's some wind outside and maybe our internet connection is not working properly. I'm going to talk about today on fevers and what you should do if you guys have fever in young kids and adults, and what is the best way of helping if we have a fever. Is fever is a bad thing or is a good thing for us? So all with these questions, I'm going to discuss with you what is the best possibilities for you if you guys have fever. So first of all, I want to thank everybody. You guys can listen to me properly. So it all started with a call from my nephew from Boston, who has a 1-year-old son, and he told me that you take a Motrin or Tylenol to the kid, and what do you think? So I thought, oh my God, there are lots of stuff which can be done, and is this Motrin and Tylenol is completely non-toxic, which is not, and why we want to expose such a young kid to such a bad medicine. In my opinion, it's a bad medicine, and I will tell you why it's a bad medicine, because there has been lots of studies available make these drugs, especially aspirin, Tylenol, Motrin, which is the most commonly prescribed over-the-counter drug for these kind of conditions, but may not be the best thing. So I'm going to start looking at the literature which has been published on the fevers. As early as in 1980, Dr. Barton Schmidt, who is a professor of pediatrics at the University of Colorado School of Medicine, published a classic article, and he turned that article as a fever phobia. And he wrote that many parents believe that untreated fever might rise to a critical level, that even moderate and low-grade fever could have serious neurological diseases. So a lot of parents were very concerned that if their kid has a small fever or even a mild to a little high fever, that kid is going to get some neurological damage. So then later on, around in 2001, the John Hopkins doctors revisited Dr. Schmidt's work, and they wrote, the fever phobia revisited, have parental misconceptions about fever changed in the last 20 years. So they were trying to see that how people think about the fever in the kids, and the conclusion was that misconceptions still persisted. So I think there is interesting data available that a lot of people are really very scared when their loved ones, especially small kids, get fevers, and they think that fever is going to harm their kid very badly. They are going to have some neurological problem or seizures, and which is not true, which is not very true. And but these all paper has been published in medical journals. So does really fever harm the brain? The answer is no. And because there is a wonderful connection in the brain, in the hypothalamus of our brain, which controls the fever centers, and it will block that stuff to happen most of the time. There are rare cases of anything. You can see the spectrum. Rare is always very rare. But there is some percentage of children will get seizures with fever, and these seizures can be a little terrifying when their parents watch it. And basically, they are not harmful either. It's like very horrible to watch it or look at it. I have practiced for 36 years, and I've not seen very high fevers here. But when I was practicing back in India, especially in the season of malaria, the kids and the adults will come to my clinic with as high as 110, 108 fever, and it was like a nightmare. Even in adults, that high fever, they were completely delusioned. They will be saying things which they don't know what they're saying, and there will be a lot of seizures in those people too. So yes, I've seen those people there too, and but those are rare, and that especially happens when the bug gets to your brain. But even if you get a little seizure, it's not dangerous for the kid. So just want to let you know that. So because the parents think that seizure is going to kill their kid, and this is not true. And this is not my conclusion, but this is also conclusion by the pediatrics professors of Johns Hopkins, Harvard, and all those very expert in this field. So I think one other thing which I want to let people know, that they should let the fear go that their kid is going to have a problem if they have a high fever. So basically, I think the part of the problem is also our medical establishment. The doctors and the nurses, they also not teach the patient right. And so when a doctor says a word, basically that becomes imprinted in a parent's brain. They think that what doctor has said is a God's word. And so a lot of times what the wording which we say to our patients, I think we have to be very careful, especially for a worried patient and their caretakers, parents, or any relatives, because it becomes so scary for them. So if we use a word, okay, you can get a seizure, that if even they don't get a seizure, they are thinking he is getting seizures with the high fever. So I think there should be a way of saying things in a different way, and which people will not get too much panicky. So first of all, let's look at, if the fever is really bad for you. So, no, fever might look very uncomfortable. If your body feels hot and you have body aches and pains, and it makes you feeling like a blood. People may be nauseated. You may have sometimes you have a diarrhea, and your body is hurting. Your brain is kind of hot. You may get a headache because of all those symptoms with it. But the fever, as it is, not bad for you. Fever is not a disease, by the way. Fever is a symptom of underlying cause in your body, and that cause can be a virus. Most of the time, it is a virus, then bacteria, and then sometimes injury, sometimes toxic drugs, which can also cause the fevers too. So the reasons can be many. But if you look at it, when you got a fever, there are special immune cells which are getting triggered, and these immune cells actually helps your body to get stronger. And some of them we call them lymphocytes, also CD8 and cytotoxic T cells. There is a technical word which I don't want to use too many here because my audience is not the doctors there. So basically, what you need to understand, the immune system gets activated. And when the immune system gets activated, the higher the body reaches the temperature, the more immune system gets raised. So, which is a good thing for you. So that means when you are getting fever, your body is mounting a immune reaction to help your body. So you can tell me now, is it a bad for you or is it good for you? There is a tons of data available, tons of research available on it, and because, which shows that the fevers are helpful for you. I see a lot of cancer patients, and we see a lot of chronic diseases. I use in my clinic here in Bellevue a fever therapy. We put people in sauna, which is basically we artificially inducing fevers in people, and people get some people get up to 102, some up to 103 fever sitting in a sauna. And so for a lot of cancer patients, a lot of chronic diseases like rheumatoid arthritis, Crohn's disease, ulcerative colitis, autoimmune diseases, we induce this body's immune system to help to get rid of that disease in the body. And I'm very happy to report that a lot of our patients who go through that cleansing program in our clinic get better. So what I'm trying to tell you that the fever is not bad for you. It is actually a phenomenally good thing for you. And when we're suppressing this fever, then we are causing problems. So now let's look at it. How high fever is a good fever for you? So up to 102, I will not worry about anything. So, a lot of times, patients who will get 100, 101, 102. Up to 102, you should be fine. As long as your kid, and especially talking about the kids, even adults, can have, he is active, he's not lethargic, he's not throwing up, he's not dehydrated. So you have to watch it, because I think in today's world, we have become so savvy of popping in a pill and suppressing a symptom of any disease so that we can have a little time. And most of the time, the parents does not have time. Mother is working, father is working, and they can't take time off to help their kids. So this is, which is not good, because when your body has a fever, or a kid has a fever, you need some extra attention, certainly. But basically, if you are not trying to help the body, you are causing some other kind of disease to happen in the body. So this is also, you need to understand that. So if you look at it, there is a lot more allergies happening in our kids. There's a lot more diabetes happening in our kids. There's a lot more cancers happening. If you look at the data from since 1980, all these diseases has gone up. So are we suppressing one disease and we shifting to other disease? This is a question to all of us. Are we doing something good for our kids? Are we making them more sick? So in my personal opinion and research tells that when we are suppressing, we are going to do something different in the body, and it's not going to help the body. So basically, fever is a good thing. So a lot of times you can easily distinguish between a viral fever and a bacterial fever through a blood test. I do those blood tests in my clinic. Even small kids, you can, nowadays there's advanced technology available. You don't have to draw from the blood vessels. There's a small volume of blood you need, and you can get results from CBC, which is a blood count, within half an hour. If you call a lab and they get a stat result, so that can tell you which direction the body is going. Is it a viral infection or is it a bacterial infection? And usually bacterial infections are not considered good. Viral infections, there is not much medicine. If those medicine which is given like a Tamiflu kind of stuff, which are actually more harmful, it does not decrease the severity of the disease. According to the studies, there is only less than few hours of benefit over people who do not took Tamiflu, which is again a toxic medicine in my personal opinion. So you just have to ride the tide and help your body to get rid of it through its own process. And so if the body temperature is going around 102, you're perfectly okay.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Coming back to the fevers again, so when you have a fever up to 102 temperature, you don't have to be worried about it. Most of the time, just watch for these symptoms, like the kid should not be lethargic, should not be dehydration. And, the fever is, as I said earlier, is just a sign of something going wrong with it. It can be infection. It can be dehydration too, by the way. When people are dehydrated, they can have also high fever.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So we were talking about the fevers and how the fever is just a symptom. It's not a disease itself, and this can be because of the infections, can be virus, can be bacteria, can be dehydration. It can be due to vaccination, can be drugs sometimes the inflammatory disease like arthritis, or even, the trauma, if your body got some traumatized or teething, all those things can cause fever. This is just a symptom. But if you have a fever above 104, 106, then you're thinking about, some harm to brain and the heart. But once your fever go above 102, I think you start doing some stuff to help cut it down. And simple remedies like soaking a rag in a cold water, putting on a head. You can do a sponge on the body with a cold towel. You can also soak the legs in the cold water. That will bring the fever very, very quickly down. And so, monitor it. It's like if you're not using the drug route, which is not my favorite way of doing it, because fever is a good thing, as I said earlier. It's not a bad thing for you. But if you are, and the Motrin, Tylenol, and aspirin, I will tell you the side effects of it a little later, is not my favorite. And when my kids were growing, I never gave them. These actually, as a matter of fact, these drugs are not in my home even today. And I never use because those are so toxic drugs. There is more than 8,000 people die with the Tylenol, aspirin, and the Motrin kind of drugs every year. So that is around 20 plus per day. So if you can see that how many people are dying, and do you hear it in the news? You never hear it in the news. If you want to look at the data, go on the CDC and death data on these non-steroidal anti-inflammatory drugs, and you'll be very surprised to know that these drugs have that many death rates. So once the fever starts to go up above 102, you can start doing some cold sponges in the head. Put the cold sponges on the legs, on the forearms, upper arms. You can take a cold towel and wipe the whole body. It's not going to be any harmful. Usually when the fever is rising, there is a rigors, there is a chills coming with it because of it's like when you're exposed to the cold weather outside, and all of a sudden you're shivering, and so you get that's the initial shivers, but once the fever go to a high level, the rigors or the shivers, you cut down on the shivers. So the cold towel you can sponge the whole body. Another grandma recipe which has been used for centuries is using a coconut oil massage on the head. So you take a coconut oil and rub it on the whole head and even the whole body, and you'll be surprised to see how quickly the body temperature drops around a couple points, 2-3 points. So if you have 103 temperature, you're going to drop it to 101, which is now our safe range. We are not worried about that temperature because temperature is good for us. It's not bad for us. But if the temperature is not going down by the third day, usually it will peak it up for one day and then start coming down. So usually most of the time the fever will last for 1 to 3 days and then it should be perfectly okay. And I will not recommend waiting more than that, and certainly needs to be seen by a physician to see what's going on with it. Is it a viral? Is it bacterial? Because if it's bacterial, it can be dangerous, and cause some problem. And so there is a caller on the phone, and caller, go ahead. This is Dr. Sodhi.
Hi, Uncle. This is Paras from Boston.
Hi, Paras. How you doing?
I'm doing good. I thought since you got the idea for my call, it's only up for me to call you and say thank you. And I think it really helped, all your advice which you gave for my son's fever, from coconut oil to kind of quickly identifying a homeopathic medicine which can help.
That's right.
And I think the point which you were saying earlier in terms of Motrin and Tylenol, I know that's kind of the recommended procedure every doctor in the U.S. basically follows, but it really wasn't helping in our case. So 1 hour, 2 hours, the fever would go down, but it would continually bump up. And I think the homeopathic medicine which you suggested along with the natural remedies really helped and kind of brought the fever down.
Yeah.
So I think my question really is, what kind of your recommendation or suggestion in terms of things which are available at home, especially the Indian homes, which can be used to kind of bring the fever down and kind of help kids recover from it, especially they are very receptive to the medicines, any kind of cold packs and everything. So if you can kind of help us, I think that will really help.
Great. Good question, Paras, and thanks for your calling in for the show too. So basically, the first recommendation is coconut oil, ghee, and that does not bother a kid at all. But cold sponges, yes, it's not very pleasant. Kid is already irritated, and you can ring the sponge, because you need to help him. So I think cold sponges is the best way to do it because it brings the fever very quickly. And even when people has a very high fever, they in the hospital that's also done, which is we call hypothermia treatment. And I know back in India I used to give IV bags full of the cold IV bag for people who was very, very with 108, 110 fever. So that's way of doing it, bringing it down. But home remedies, ginger is a really good one. It burns off the fever. You can mix ginger juice with honey. That's a really good. Licorice, which is available over the counter. You can give drops of it. There's 5 to 10 drops up to 1 to 2 years of a kid will be very safe and licorice, again, is not toxic for you. The holy basil is another best remedy for which is available at home, which you can give. So these are the few things. But homeopathic is wonderful. Although I'm not classic homeopath, and I don't dare to say that, but there are wonderful symptoms of homeopathy. As I will be a grandpa, and when my kids will have kids. So I was saying to my wife, I want to get trained, especially in kids, with homeopathy because it works like a wonders in kids. So it looks like there is another caller. Caller, go ahead, please. Okay, so I think we may have lost it. So we were talking about the treatment at home treatment. So ginger, licorice, holy basil are really good. Even turmeric, you can mix turmeric with honey. The recommendation in the U.S. that below 1 year of age you don't want to give honey. Although I found it ridiculous, but I don't think there is any problem with it, especially with botulism. That is the scare. I don't see any case has been recorded in the last so many years who have taken honey and died with it, but still persists. So some of them are like medical myths which continues to be practiced even without the real solid science behind it. But those, if you don't want to use, still you want to follow that, just turmeric mixed with water a little bit, and or you can mix it with some milk too. If it is a small infant, mother's milk can be used, or other milk can be used and given to the baby, and it has a phenomenally good anti-inflammatory properties and also brings the fever down. So you can do these home remedies, and of course the homeopathy is really good. And as I said, I'm not trained, very well trained homeopath. I am a herbalist, and I'm a trained Ayurvedic doctor and in oncology, and I use that. But the other herbs which can be also given is like a catnip, echinacea, licorice, which I said already, are really good for these kids. So let's talk about what are the drugs or treatment given to these kids. And the aspirin has fall off the favor because of the Ray's syndrome, which I will discuss a little later. But aspirin has lots of side effects. One thing is, it's really bad for your stomach acid. People get heartburns, and people get nausea, vomiting, and the intestines doesn't like it. It irritates the intestine. Some people get cramps with it, and especially for the kid. And it's also blood thinner. Many people die with the bleeding, internal bleeding, and so I will not give it to the kid at all. And basically, the aspirin is not my favorite to give to the kids because this is not the best thing for you. And basically because of the bleeding disorders. And there's a lot of death, as I said earlier, happens in this group. Around 8,000 people die per year. That's more than 20 people per year die per year with the toxic effect of these drugs, and then the slew of side effects on top of it. Especially aspirin, for example, causes even liver failure, allergies. A lot of people get skin reactions with it. Even can be really bad for the kidneys, and some people can have just threatening allergic reactions. Some people can have even seizures with it. So there is slew of these side effects which, although maybe very low, but there is chances of, even if it's 1%, I won't say less than 1%, still, because if you're exposing the millions of population out there, you are going to have more problem. And I talked about the Ray's syndrome. Ray's syndrome is a rare disease, but very serious condition, because what happens in this one, the liver gets swollen up and the brain gets swollen up. And with especially the people who are having viral infections, especially like flu or chicken pox, and so they are given aspirin, and then these guys can have a problem with it because these drugs kind of reacts with these people, and they can have seizures and loss of consciousness, and the actually emergency treatment needed for that one. So That's why I don't like these kind of, drugs, and especially the aspirin and Ray's syndrome has been linked. So basically, whenever your young kids and teenagers have fevers, flu fevers, or chicken pox, or any viral fevers, I will not recommend to giving aspirin at all. Then the second most, another common one is Tylenol, which is a Johnson & Johnson trademark, and it has been used for many, many years, almost since 1955, when the first drug was sold. And so it's like a lot of the kids who has grew up in this age and era has been exposed to this Tylenol. So let's look at it, how it's around 28 billion doses are sold since 2005 alone. So you can see, how much commonly used is this drug. And it is really a lot of money is brought out by this medical, almost $1 billion a year just for the Tylenol. But it is the number one cause, listen to this carefully, number one cause of liver failure in the world. Number one cause of liver failure in the world. The drug Tylenol, which is a chemical acetaminophen, is so toxic to your liver that it can fail your liver. And a lot of folks out there, this is for even adults. So you had your favorite wine or martini or beer overnight, and maybe you had too many, maybe you had 3, 4. People like me, I can handle only one, one glass of wine or one beer, or just one small shot of alcohol. And even people like me, who we get a headache with it, and next day we take a Tylenol with it, that can be a fatal combination for your liver. So please don't do that if you get a headache after you have taken too many of them. And it's very common practice, by the way. And a lot of people I know, and since they have come to my contact, and I've ward them off and then try to steer away from those combination drugs, they will pop in 4 or 5 of these pills to get the headache, or because the headache is so intense, they had too many of the alcohol, and now they're trying to ward off the headache there. So basically, what you can do is you can take a ginger tea. Ginger tea is phenomenally good for getting the headaches off if you have alcohol, and also ginger helps the liver to flush. And you need to have a lot more green vegetable to flush your liver. So the green smoothies, like a pomegranate juice, has a soothing effect. Cooling herbs like aloe vera has a really good effect. Cooling herb like fennel and dill seed will have a good effect on you. So, try to stay away from alcohol and Tylenol completely, because that would be not a good combination for. And a lot of people I know, they have been popping in Tylenol like a candies. Every day they will pop in. And again, you are pulling yourself into a dangerous zone, and especially for the kids, because they can have a severe liver damage. I don't want any kid to have a liver damage with the Tylenol. And the treatment is actually, you have to do it very, very quickly, because it can be very, very fatal. And as an interesting fact, the treatment is with a natural compound, which is called NSC, or N-acetylcysteine, which is given IV to because it flushes the liver, or alpha-lipoic acid, which also flushes the liver, and which has come back to the natural medicine again, which is even given in the hospitals to get rid of the toxic effects from these drugs. So the third class of drug which is used for this condition is like Motrin or ibuprofen. And the ibuprofen is not different in mode of action from the drug like Vioxx, which is called COX-2 inhibitors. So in 2004, Vioxx was recalled because it was first touted as one of the best drugs for arthritis. And then the FDA recalled it, and there has been around more than 30,000 excess heart attacks or sudden cardiac death caused by the drug between 1999 to 2003. So a lot more people who were taking Vioxx for their arthritis pain got killed. So this drug is very similar to ibuprofen, and I don't know why we're not keeping that data on the ibuprofen, but again, these combined together, there is more than 8,000 deaths happens every year with these drugs. So you can see that this is not the best way of helping the whole body. And and you plus, you're not helping, as Paras mentioned there. When you're getting a high fever, it is just temporary fixing it, allowing the body to. The action is called antipyretic action. So it lowers your temperature for just a little bit, and after that, you are again up. And I rather not like to suppress that fever, because the fever is good for you, and you can help the body to get into a normal zone by just doing sponging, keeping your system more hydrated, drinking more water, and maybe taking some soups and light food, which will help you to come out of dehydration. The more fluid intake will help cut down the fever too. So you can see, why I'm not in favor of all these drugs, because these cause a lot of side effects. And again, the ibuprofen causes anemia, DNA damage. Do you want to have your DNA damaged? Because no, we don't. Hearing loss, high blood pressure, and the mortality in influenza increases with ibuprofen. There is a lot more miscarriages happen with the Motrin or ibuprofen, and on top of it, more heart attacks. So you can see that this is not a good combination. So then, what is there, what you can do to help these things when you are having these kind of problems? So we'll come back after the little short break here. And sorry, we're having a technical issue. I think we have a very strong wind today going on in Seattle area, and the towers are kind of messing up, and so is our program got a little disturbed there. So I will come back again, and we'll discuss what you guys can do naturally to help with this fevers.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
We were talking about the treatment part of when you have fevers, and what natural alternatives are there. So a lot of time people say, do you guys have any evidence? There is any published data available on it? Yes, there is a published data available. And one other thing which really bothers me about the evidence kind of medicine, a lot of drugs which we're using today, they don't have evidence, like statin drugs for heart disease. There's no data available to support that statin drugs help it. And the antibiotics which we're using in the 40s and 50s, we're not using it. And so that means the evidence has changed, and we are not, getting the results which we used to get. And plus, there is a resistance to these drugs, and the more you take, the more toxic your system gets. And they are not the best way of it. I think the body is itself a natural pharmacy. That's why the name of my program is Your Body is a Natural Pharmacy. We make every damn drug on demand. But what stops is our one thing is our thought process, not following the laws of Mother Nature, not breathing properly, not drinking water properly, not eating right kind of food, not doing proper amount of exercise, not getting good quality sleep. All those things are just a free medicine. And when you follow those simple laws of Mother Nature, you are going to get best results. So the natural alternatives for ibuprofen are Tylenol or aspirin. one of my favorite remedies is ginger. I give ginger more almost for anything. Your tummy ache, you take a ginger. Fever, you take a ginger. You have a body aches and pain, you can take a ginger. And ginger has been shown to be as effective as ibuprofen in relieving pain. So you can see, and this is a study published in 2009 in the journal. And so, you can certainly see that we have big, huge advantage of using these natural medicine, because there is a obviously very little toxicity, if anything. There is a toxicity with everything, by the way. So I'm not, because I'm a natural medicine doctor, I'm not going to say that, oh my God, there's kind of zero toxicity. Yes, there is a toxicity, but the toxicity with the natural remedies is as low as with the food. Just to get a comparison here, the third leading cause of death is pharmaceutical drugs and hospital errors. Number 1 is heart disease. Number 2 is cancer. Number 3 is pharmaceutical drugs and hospital errors. So you can see there is a huge death rate happens because of the drug use. And if you look at the analysis done in 2015, how many people have died with the natural remedy? 0. There was a 0 death due to herbal supplements and the vitamin supplements or homeopathic medicine. Zero people, as compared to, I think, more than 300,000 people die with the pharmaceutical drugs. So this is a really simple way of helping the process. And I'm not saying that these drugs doesn't have any place. Yes, they do have a place, but it should be used as a last resort and not randomly just, okay, you got a little fever, let's pop in a pill. That may be not the best one. And as my nephew from Boston said, their son got wonderful results with the homeopathy, and we use the belladonna. The belladonna has a specific symptom of a red hot face, and so I was doing FaceTime with him, and I said, okay, can you show me his picture? And when I look at his face, it was a red hot. And I said, the belladonna will work. And so he went to the store and got the belladonna and got good results. And there are lots of other remedies like that. Like one of them very commonly used for a lot of things, especially for trauma, is arnica, which is, again, the homeopathic medicine is non-toxic medicine. It does not have any chemical in it. So just take energetic medicine, or you can talk about a nanomolecule of a certain herb or material which is used as a homeopathic medicine. So there is actually not if you want to analyze it, you will not find any chemical in it. So there's zero toxicity with homeopathic medicine. And especially for kids, these homeopathic remedies works like a charm. I think every home should have these small remedies like arnica and belladonna and other, small chest box. They should have it. And you can actually, and these days you can go online and can find out very quickly which remedy you need. The homeopathic medicine, you look at the symptoms which is expressing in the body, and you go and you make a remedy for that one. So then there is another one, which is very favorite of everybody, is like vitamin C. And there are vitamin C-rich fruits and vegetables, like oranges. You can eat them. They have a good effects on people. And the Ayurvedically, we have amla, which has a phenomenally good bioflavonoids and also rich in vitamin C. So you can use amla as a preventive and as well as when the people has a problem. There is like omega-3 oils, which is as effective as ibuprofen in cutting down the inflammation or pain. And so the kids, there are actually a flavored fish oil available in the liquid form, and they have combined with some other stuff in them, and it is very palatable, and kids can take it. So that's another very simple remedy there. Again, the cherries, raspberries, which has those colors in them, the dark blue colors, dark red colors, they are phenomenally good, and their effect has been compared to naproxen in suppressing the inflammation and the enzymes. So, these simple remedies are very, very effective. Again, licorice, holy basil, turmeric. These can be used very safely without these side effects or without the toxicity in these people. So basically, you got my point there. The fever is not bad for you. Fever is good for you because what the body is trying to do is a mount a reaction so it can fight the disease. When the body is rising the temperature, the 102 temperature is critical because at that temperature, the body is killing the viruses, the body is killing the bacteria, the body is killing which is attacking the body. And that attack is so precise, so wonderful, and the body knows the best because it has an amazing lab inside the body, and it can mount that very specific reaction for that specific virus or bacteria. But we are very intelligent, and we have been trained that way to think differently. You got a fever, you got a big problem, suppress the fever. That's really actually worse for you. It's not the best thing for you. You don't want to suppress the fever. Fever is really good for you. But yes, it comes with its own way of helping the person, and you want to make sure that you or your child is not get dehydrated. Very important, because if you get dehydrated, you're running dry and you have a high fever. When you have a high fever, you actually requirement for the fluids increases anyway. So when that you have a excessive amount of burning inside your system, you have to take more fluids. So a lot of kids die because of the dehydration, especially in the third world countries. When I was back in India and practicing, and that was a very high emphasis that we keep those kids hydrated. And so I used to tell them to get an oral rehydration solution, which you have to understand that a lot of Indian population was poor, and is still poor, many of them still, although it has a highest amount of millionaire in the world, but there is still the 1/3 population is very poor. So these, I used to tell them, get some sugar, get some salt, get some baking soda or a dab of lime and lemon, and put in a glass of water, maybe 1 teaspoon, and because it's sweet, so kids love it, and with the lime it's become more palatable. I can drink it. So if you can keep the fluids inside, and so what I've done is modified this oral rehydration solution, and I ask my patients to use honey instead of sugar, and they can put a little bit of salt, maybe just a 1/4 teaspoon, and maybe 1/4 teaspoon of baking soda, and put a little lime, say lime or lemon, maybe 1/2 teaspoon, and put it in a glass of water, and it becomes very nice and palatable. It's sweet. Kid will take it easily, and keep hydrating them. Or if you don't want that, you can also give water. Coconut water is another good thing. Aloe vera juice would be another good thing. I don't recommend too many juices because that is not the best thing. So this is how you can take care of a fevers very easily at home. And you guys can also, if you missed out my radio talk shows, you can go on our website, www.ayurvedicscience.com, and go under resources, and there are podcasts there. So you can listen to lots of other podcasts which we have done in the past, and you can also go on Twitter, Dr. Virender Sodhi, and you can also see us on my Facebook, ayurvedicscience.com, or on Pinterest. And out there, stay safe, and tomorrow I'm going to go to Arizona to speak at a medical conference, and we'll be talking to doctors, and but I'll be flying back in the evening, so I'll have a little hectic schedule. Until then, until next program, have a wonderful day, stay safe.